to Republican Senator John Kennedy, who wants big changes to the bill. I don't know what will happen in the House, but let's say, Senator, they do pass it by hook or crook, and then it gets to you. What would you want to see change if it is pretty much the measure that we've heard talked about?
I'd like to see the work requirement for Medicaid made non-optional. Right now, a governor can choose to implement it or not. I think it ought to be a requirement. Number two, I would like to see the mandates for the provisions of an insurance policy change. You know, today I can go to the grocery store and choose among 14 varieties of mayonnaise. I don't know why I shouldn't be able to do that for health insurance. Right now, under Obamacare, the government's telling every insurance company, which is taxing, by the way, after it taxes them, government tells them what they got to put in the policy, and one size doesn't fit all. I don't like that. I'm not giddy with joy over the bill right now, but I think it can be improved, and it appears to me that it's better than Obamacare.
All right. Let me ask you, Senator, we're getting indications here that Speaker Ryan still plans to hold this vote today, which means that he's optimistic the votes are there, the 260 votes are there in the House to get it approved today. I would assume that if he didn't think he wouldn't dare bring it to the floor. Am I missing something or what?
Well, you're probably right, but I think it's going to be very close, and I think some of the votes are fluid. I don't know if it's going to pass.
Yeah.
If it doesn't pass, it's not going to be the end of civilization. We'll come back and try again.
Here's why some people worry about it, as you're aware better than I, sir, that if it doesn't pass, whatever the merits or lack thereof in this, that it pushes everything back in the Republican agenda. Do you buy that? And do you think if this is getting to be such a thorny issue that Republicans dump it for the time being and focus on comprehensive tax reform?
Well, it is a thorny issue. It's also an extraordinarily important issue. Yes, the ideal situation is to do health care and then move to tax reform. I'm very interested in tax reform. Tax reform to me means lower taxes.
If this thing got stymied, sir, I mean, would you be willing to say, all right, forget it?
Yes. No, I'd be willing to come back to it. We got to get it right.
You want to get this right first before tax stuff?
I do want to get it right.
Okay.
But we're in agreement on one thing. I don't mean any disrespect, but I think a vast majority in both the Senate and the House agree that Obamacare sucks. I mean, it's horrible. We can do better. We're not going to come up with a bill that's perfect, that everybody is in love with. But the current House bill, I think, if you're going to be reasonably objective, is better than Obamacare. But we can make it better still in the House and in the Senate.
But aren't a lot of your Republican colleagues saying, Senator, that to your suck analogy there, that at least it's not the Titanic. If it's still sinking, it's still bad, right?
Well, I don't know if I would use that analogy. Look,
I was just trying to clean up your language, that's all.
Yeah, I understand. I said I meant no disrespect.
I'm kidding you, I'm kidding you.
But I think that's what, my way of expressing it, I think that's what the majority of the American people think. Look, I'm interested in primarily lowering costs, to help 20 million people, and they're important 20 million, but to help 20 to 25 million Americans. Under Obamacare, Congress turned upside down the health care delivery system for the other 300 million. I'd like to try to do something for a change that helps all of them. And for a change, I'd like to try to design a system that looks like somebody designed it on purpose.
Senator Kennedy, well put. Good seeing you.
Thank you.